So that was in the fundraising last year, at the height of the crisis, really, as we all got familiar with COVID. And the call went out across society. So we received funds from foundations, we received funds from political parties, from international sources, as well as a whole lot of local corporates, as well as many South Africans, many individuals.
Yeah.
So in terms of application, those funds have largely been applied to under the health pillar, the ventilator project, the PPE, which was so necessary right at the beginning, and continues to be so, and food parcels and food vouchers, agricultural input vouchers, and quite significantly also to the communications program that assisted many a South African to understand what COVID was and how to respond.
You've worked with the Department of Health with that 283 million payment for the COVAX facility, for instance. How will this relationship work for the national vaccine rollout plan?
So it'll work in a very similar fashion, actually, as we've been working over the past 12 months, where we position ourselves very much as an additive part of the solution. So the National Department of Health, together with partners, crafts a solution, and we would then play a role that we believe that the Solidarity Fund is uniquely placed to play.
There was an emphasis in that briefing on what the Solidarity Fund will and won't get involved with in terms of decisions around the vaccine rollout. Can you just reiterate that for us?
So the key points are the Solidarity Fund, for instance. It's clear that the government are the sole procurers of the vaccine. So the Solidarity Fund won't get involved in procuring vaccines, selecting vaccines, selecting even suppliers, whether it's vaccines or otherwise. So essentially understanding and being clear that our role is very supportive rather than directional. Mm-hmm. The direction and appointment of suppliers, etc., that is very much within the NDOH space. And other government bodies, yeah.
Okay, of course, the vaccine and getting vaccinated is not a panacea for the pandemic. There's also been a concern, in particular, around the number of people who've been vaccinated in South Africa. I think the number is 0.31 out of 100 compared to, say, 6.6 out of 100 in Brazil. So you've also spoken about how, as the fund, you're going to get involved in things outside vaccination in order to encourage people to be safe.
Yes, so what we have had actually still remains the best barrier to transmitting or getting the disease, other behavioral aspects. Those behavioral aspects are key to us getting through, and hopefully what we call a third wave will be a small peak rather than what we saw with the second wave, which I think touched most South Africans, if not all South Africans, in one way or another. So the point is that wearing the mask and wearing it properly over the nose and over the mouth is critical. Social distancing is equally critical. And one of the aspects that perhaps people haven't been as alive to is the ventilation aspect, where keeping the windows open and keeping the air circulation moving in any space that you're in is quite important, particularly when you're with other people in that space. Mm-hmm. And of course, avoiding large gatherings. The vaccine is not a panacea, not even when we have had it at scale. Because if you think about it, the vaccine thus far, what it addresses is one not getting very sick, very sick. So severe illness, and it addresses death. It does not address things like transmission, for instance. So it hasn't been proven that it addresses transmission. So people who are vaccinated are still able to transmit. So everybody, actually, until we reach herd immunity, is encouraged, very strongly encouraged, to continue with the behavioral aspects.
All right, so the one thing is that COVID-19 didn't arrive and doesn't take place in a vacuum, especially in South Africa's economic context. We know that even going into lockdown, we were in recession and suffering difficulties. There was also the legacy of inequality in the country. When you are taking those donations and funds and procuring things, are you looking at empowerment, transformation? Is there a particular part, perhaps, of your procurement, rather, that you are saying needs to go to Black business, women-owned business, youth, and the like?
So it has taken us a bit of time to get to a point where that is very much on our radar screen. We noting that it's in the context also of wanting to have national reach and scale that in the space that we work on. So very much looking at equity. I think right at the beginning, perhaps the first month or so, the focus was really on just trying to get as much as possible PPE onto the country. And that wasn't firmly on the radar screen and has come very firmly, much more so since then.
Thank you so much for your time on SABC News. CEO of the Solidarity Fund, Tandi Nzimande, joining us there after their briefing a little bit earlier on. Epidemiologist Professor Sarim Abdul Karim has announced that he will be returning to his academic commitments after his term as co-chair of the COVID-19 Ministerial Advisory Committee comes to an end. Professor Karim has presided over a Ministerial Advisory Committee that